It is my sincere pleasure to welcome you all today in the webinar series organized by the John Gerhardt Center for Philanthropy, Civic Engagement, and Responsible Business. First, I hope that you all, your families, your neighbors, your loved ones are all safe and in good health. We've been saying for some time that we live in the age of disruption and going through regular challenges and times of uncertainties and so on. However, 2020 surprised us all and took that level of disruption to a completely different level. Uncertainties, challenges all around. And at the core of all that, COVID-19 came through an invisible, stealth, vicious attack that had no discrimination, attacked all countries around the world, developing countries, developed countries, nations, and impacted economies. And the utmost priority of governments and nations is now take the precautionary measures to save their population, but also to keep an eye on how to stimulate their economies and keep going. This requires global coordination, sharing of expertise, know-how, resources, to mention a few. But more importantly, it is definitely an opportunity to rethink the social perspective and address effectively the elements of inequality, climate change, sustainability, governance, and many more. Should we revisit the Sustainable Development Goals? Should we adjust them? Should we keep them as is? I'm personally a very strong believer that disruption, as much as it brings advancement, in the same manner that challenges bring opportunities. So there is always an opening. There is always a side where we can look at the positives, try to come up with innovative solutions, but also look at the benefit of the society at large. To discuss these issues and much more, we're extremely delighted to have for today's meeting our guest speaker, Professor Jeffrey Sachs, who will address a timely topic, the SDGs in the aftermath of the COVID-19 pandemic. Professor Sachs is director of the Center for Sustainable Development at Columbia University, where he directed the Earth Institute from 2002 to 2016. He's also director of the UN Sustainable Development Solutions Network and the commissioner of the UN Broadband Commission for Development. He has been an advisor to 3 United Nations Secretaries General and currently serves as an SDG advocate under Secretary General Antonio Guterres. Thank you very much, Jeffrey, for being with us today. The floor is all yours.
Thank you very much. I'm really delighted to be with the American University in Cairo and with this seminar series. We are indeed in an extraordinarily disruptive time, and the world is upside down. In my own country, in the United States, we face so many crises, it's even hard to count them right now. We already were in the COVID out of control epidemic with more than 110,000 deaths in the United States and rising still rapidly. Now we have the social unrest because of the police brutality and the massive demonstrations around the country around this. And our society is probably more divided than at any time it's been since the Civil War, perhaps 160 years ago. So it's really a shocking period. What I would like to say for Egypt and for all countries in the world is, first, there is no alternative but to get this epidemic under control. And there is one very important point that I want to emphasize, and that COVID-19 is a controllable epidemic. The epidemiologists use the term suppressing the epidemic, meaning that it is possible to stop or nearly stop the transmission of the disease. And this is the main point that I want to mention right now, because a country like Egypt is right at the borderline between an out of control epidemic and suppressing the epidemic. It's worth everything you can put into this effort to keep the epidemic suppressed, because if it explodes into a full transmission and gets out of control, the disruptions to society, the harms of deaths, the suffering will be massive. And Egypt, thank goodness, is not in that situation right now, but it's close. Many parts of the world are close to that. If you look at the world experience till now, one part of the world has substantially suppressed the epidemic. That is the Asia-Pacific region. China, Korea, Japan, Taiwan, Hong Kong, Vietnam, Australia, New Zealand, Malaysia, Cambodia, Laos PDR, have all kept this epidemic under control. China had the first outbreak. It was really out of control. But then through very strong measures, first of quarantine, and then of contact tracing and mass testing, China got it under control. Who did not get it under control? Western Europe, including France, Italy, Spain, Portugal, even Germany, even Sweden, amazingly, did not get it under. I'm so sorry. How much have you heard or not heard? Because I switched to mute somehow. Can somebody help me?
I think if you can just sort of repeat what you've said in the last 30 seconds would be nice.
Sorry, I'm so sorry. I don't know what happened, but I was saying that the Asia Pacific has gotten this under control. This is extremely important to understand because they show it's feasible to stop this epidemic. China, Korea, Taiwan, Japan, Hong Kong, New Zealand, Australia, Malaysia, Vietnam, Laos, Cambodia. Western Europe did not get this under control. And then in the United States, it's gotten completely out of control. We're in a mess because we have no leadership at the federal level. Unfortunately, Donald Trump is the most incompetent president we've ever had in our history. And throughout the Americas, we have a very significant crisis because there are other leaders as well that are shocking in their incompetence and neglect of basic public health. Probably the country being most pummeled in the world right now is Brazil, because President Bolsonaro absolutely neglects the truth, the facts. And so as a populist president, he said for months and months, this doesn't matter. And now Brazil is having mass deaths, and it's probably the most out of control epidemic. The same is true in Mexico right now with President Lopez Obrador, who also neglected this epidemic. So my first point for Egypt is leadership counts. This is a controllable epidemic. And the places with poor leadership like the United States, Brazil, and Mexico have a disastrous experience. And in the US, despite weeks of lockdown, now half the states at least are seeing rising cases again now that the lockdown has been eased, because the period of lockdown was not used to put in place public health measures. So how is it that the Asia Pacific has actually contained the epidemic? There are two main mechanisms that are crucial, and for Egypt, one of the most crowded places in the world, extremely important. When in a city of Cairo, like Cairo, which is one of the bustling metropolises of the world, very important, both of these methods. The first, of course, is proper personal hygiene, starting with face masks. and physical distancing. People just need to stop transmitting the infection to other people. And face masks, hand washing, spacing 2 meters apart, not congregating in large congregant settings, taking great care in places like long-term care centers, prisons, and other places where people live together, and big religious gatherings. This is absolutely essential. So one is the hygiene, keeping people away from each other and not infecting each other. The second is the testing, isolating, and contact tracing of people. This means that anybody with any symptoms needs to be tested, needs to be isolated if they test positive, and that all of their close contacts, their family members, other people in the household, their colleagues, other people that they were together with, other places that they visited, also need to be contacted and then tested. So that's the public health system called testing, tracing, and isolating. What does isolating mean? In the East Asian context, isolating means putting people in a public facility that is safe for them so that they're not infecting other people, a hotel room or a gymnasium or other kind of setting. We don't do that in the United States. We tell people go home. They go home and then they infect their family members, and then their family members infect other people. And also in the United States, because of bad leadership, we have had probably 20,000 deaths in elder care centers, in old folks' homes, in retirement homes, in nursing homes, because people were not paying attention and they didn't have the proper equipment and sanitary means. So I think that this is, for me, not just the starting point, it's so much of this story. If we don't get this epidemic under control, you can do whatever you want on the economy, but we're not going to have a recovery. We're not going to have a recovery internally. We're not going to have a recovery of travel. We're not going to have safety for tourism that Egypt so much depends on. So we need to suppress the epidemic. A second basic point, we need to do that cooperatively. Egypt should be cooperating closely with the neighbors. Egypt should be cooperating closely with the European Union, closely with the Arab League, closely with every entity and organization that is part of Egypt's ecosystem economically, culturally, touristically, so that there is a common approach that's taken. Of course, Egypt should be cooperating closely with the World Health Organization as well. This is another dimension of this crisis, which is that the United States has attacked the World Health Organization, which is crazy, I have to say. Why has it done this? Because a lot of American politics is more interested in fighting China than it is in saving American lives or saving the US economy. Please be careful about this, because of course Egypt's foreign policy is also related to the United States. The US is not a safe country right now. Its foreign policy is dangerous. It is antagonistic. It's trying to create a Cold War rather than global cooperation. So my plea would be that Egypt builds dramatically and rapidly its public health capacity. Face masks everywhere, public hygiene everywhere, avoidance of major spreading events like big, densely dense events in mosques or other public celebrations that could spread the disease massively. availability of testing systems, and especially availability of contact tracing and trust between the government and the public to understand that the government's main job is to help suppress the virus so that people can stay safe and the economy can function. The choice is not between opening the economy or closing the economy. The choice is between public health and no public health. Because if there's no containment of the epidemic, there will be no economic recovery, I'm sorry to say. I'm very, very worried in my own country, in the United States, because our leaders don't understand this basic point. So they think the economy is just going to bounce back, but they're very foolish because the virus is bouncing back, not the economy. And this, I think, is the really essential point. Where will we head after this? Of course, we're going to learn that our countries were not thinking properly, were not prepared properly. You know, the United States was #1 on the list of preparedness. We had no preparation at all because our political system was so corrupt and so lacking in actual thinking that when the crisis really came, we couldn't function at all. We couldn't test, we couldn't trace, we couldn't quarantine, we didn't wear face masks. The President of the United States told people not to wear face masks. How can it be in a modern society such terrible leadership? The answer is we were not prepared at all. And this, I think, is a general point that I would make. We need to be a lot more serious in governance. Governance is not a game. Governance is not a reality TV show. Governance is not some kind of zero-sum power struggle. Governance is solving problems. And for solving problems, we need thinking institutions. That's why we need universities like the American University as being so central. Any government that views its universities as an obstacle doesn't understand what governance is about. Every government should be partnering with its universities to solve critical problems, whether it's water, sanitation, food security, land use, renewable energy, all vital issues for Egypt in the future. And this, I think, is the first lesson of this pandemic, is that we stopped thinking. We were just struggling for power, not having thinking governance. When we too turn to thinking, and I hope it is post-COVID soon, because this epidemic could be controlled soon, then we should think about the fundamental objectives of sustainable development, which is decent lives for all people, good education for every child, a healthcare system that supports the well-being of the population, and the skills for decent livelihoods. We will also be moving much more to a digital economy. This is obvious. We've been pushed into the digital economy by COVID-19 dramatically. People will work from home. E-commerce will be critical. E-governance will be critical. E-payments will be critical. And so building that digital economy effectively will be a major opportunity and a major objective for the post-COVID-19 economy. So I see the post-COVID recovery based on 3 principles. One is social inclusion, which we did not have adequately. That means health and education and infrastructure services for all. Second is a safe and clean energy system, which is based on not fossil fuels, but on renewable energy. And if ever there's a country with the sunshine for a solar-powered economy, it is Egypt. And so this is a fantastic opportunity. And the third is a digital economy. And again, I think this is another great opportunity for Egypt. So I'll stop here, turn it back over to you, just to say we must stop the spread of the virus. Number one priority. After that, we will then be able to move truly to sustainable development. To stop the spread of the virus, it's a combination of good leadership and knowledge. Those are the two critical factors. Thank you very much.
Thank you, Professor Sachs. Now, most of the comments or the questions, some of them are around, well, the SDGs and the 2030 strategies and how they should accommodate COVID-19. Lots of people are talking about should, for example, goal SDG number 3 become more of a priority. What is needed? I mean, there is a tight schedule in 2030, and with the current disruption, most of the countries will simply not be able to meet it. So I just want to hear your comment about this.
Yeah, I think that the essence of the Sustainable Development Goals, even before COVID-19, was adequate public investment in the health systems, in education, and in infrastructure to upgrade the functioning of our societies and our economies. So I always viewed the Sustainable Development Goals as a public sector-led investment strategy as being crucial, whether it's in health, education, job skills, renewable energy, 5G grid, and the like. Now, that remains true now with COVID, but it's much harder because our governments are also losing revenues tremendously. So we have a financial crisis right now that has gone on top of this public health and economic crisis. How will our governments pay the bills in the future? Well, we're going to need a reckoning on financial policy. You know, the United States government doesn't care very much. It's got the Federal Reserve. They're just printing trillions and trillions of dollars. For the moment, that is adequate. But that won't work for Egypt. Egypt, unfortunately, can't print trillions of dollars. And so there's a big question how Egypt is going to finance the Sustainable Development Goals. I believe we're going to need to have an international conference or arrangement. We had one in 1944, the Bretton Woods Conference. We're going to need a new international financial arrangement so that countries can finance their way, because this crisis is going to leave a dark financial shadow, and it's not going to be solved by Wall Street, believe me. It's not going to be solved adequately by the official institutions. We're going to need new forms of international taxation. We're going to need new revenues. We're going to need debt relief for a country like Egypt and many, many other countries. And so this is, unfortunately, a big part of the puzzle, that on the one hand, the investment needs increase, but on the other hand, the financing means decrease in this crisis. But we can't just tolerate this. We have to respond to it and come up with new financial approaches. SDG 17, if you actually read the targets of them, 17.1, 2, 3, and 4, talk about international financing for the SDGs. This will become more important, and I'm advocating new international solutions around taxation, transfer payments, debt relief. All of this is going to be needed.
You're actually resonating what many of the people were saying, that you should not go back to the normal, because the old normal was fragile, not fair, rife with inequality. I'm going to quote actually the Minnesota government. He said normal was not working. Now, the interesting thing when you talk about SDGs in general, and you've mentioned this, the first priority is social inclusion, is about inequality. Now, inequality is really sort of confined to the SDG number 10, and the gender equality. But when you look at inequality, it's across the board. I mean, poverty is a form of inequality. When you talk about education, you talk about health, you talk about access to clean energy, access to clean water, inequality is really cutting across. maybe the current way the SDGs is done, this is not amplified enough. That, because when you talk about inequality, then you're really talking about structural change. So I just want to hear your comment about this.
This is exactly right. Most of the SDGs are about universal access to health, universal access to education, universal access to decent jobs, universal access to digital technology, and so forth. So that is an equality agenda in that everybody should have the basic needs met. I regard the SDGs as our generation's response to the Universal Declaration of Human Rights, which I think is the founding charter of social inclusion. 1948, saying there's dignity for every person on the planet, and therefore every person on the planet has civil, political, and economic, social, and cultural rights. And this is what we're trying to achieve. The interesting thing is the technologies, like the one we're using right now, digital technologies can support this because people can have more access to payments, to voting, to governance, to education, to telemedicine through these new technologies. So we have better ways to achieve universality, but our systems are not fair, and the way that they're constructed leads to even increased inequality. For example, who has been the biggest gainer in this epidemic? You know, most people have lost, but there's one person, I know two people who have gained an unbelievable amount. Jeffrey Bezos, who owns Amazon, has seen his wealth go up by $35 billion since the start of the year. $35 billion up in this epidemic. Well, Mr. Bezos is just going to have to share some of that wealth with the rest of society, or we're not going to have society. Nobody, in my view, in this planet, nobody should have $150 billion of wealth and rising fast, because the counterpart of that is people are starving. And so we need a system in which human dignity is respected for everybody. And we need to use this wonderful technology to reach everybody in a very conscious way. Generally, the main way to accomplish that is through effective public policy, because government is our means, when it works properly, to ensure that everybody has access to a service. Markets are what we have when output is allocated on the basis of ability to pay, but politics is what we have when output is allocated on the basis of individual rights, or at least it should be. So this is my answer why we need enhanced public investments and why we need redistribution of wealth as part of the solution.
Interesting. That's actually leads us nicely to the other point. You're probably aware of the framework called the GAP frame. The GAP frame is developed by a business school in Lausanne and St. Gallen. Now, the interesting thing is that they've actually complemented SDGs in two areas, mostly two interesting areas. The first one is governance. So they've added business integrity, they've added also public finance, and they've added transparency. So missing from the SDGs, and those are very critical when you talk about government and responsible governance. Now, the other thing they've added, which is also interesting under the quadrant of the society, they've added something called social integration, which we found very like in the US or even in Egypt. I mean, every country, there is, with the rise of inequality, there is a chasm between the have and the have not. When you talk about digital transformation, the education, you're creating few people who could get the $1 million, and another people who could barely live. So this actually gets you back to the point. Do we really need to revisit structurally the way the SDGs are?
I think we really need to revisit both the purposes of government and the ways that government functions. And in my country, you know, for 40 years, government was attacked. Actually, Ronald Reagan, who was president in the 1980s, said government is not the solution to our problems, government is the problem. We had a president who attacked the very idea of government. And many that came after him in the so-called neoliberal approach attacked government, said leave it to the marketplace. This was a fallacy, of course. By leaving, quote, to the marketplace, we allowed inequalities to soar. Moreover, government fell into the hands of the richest and most powerful people. So it became an instrument of corruption. And the US is unfortunately an incredibly corrupt government right now, because the way the Americans do it, they legalized it by saying you can make campaign contributions of any amount. And so our campaigns cost $8 billion. Well, you know who ends up controlling things. If it's big money, it's controlled by the oligarchs, which is what we have in the United States. We have an oligarchy or a plutocracy in the United States. Well, it came to a head 2 weeks ago. You know, after the police violence, there have been protests all around the country. And Trump, who is an oligarch himself and plutocrat in chief, said, okay, that's easy. We'll just send out the military to crack down on the public. And this was the closest America has come to martial law. And we almost came there, but the Pentagon said, no, it's not the job of the military to crack down on the civilian population. So America right now is in turmoil because the only way to live in such inequality is through repression. And if you don't want to live in repression, you have to address the inequality. And this is the basic choice. It's not surprising, by the way, that another hugely unequal society is Brazil, because it's the same story in Brazil. Bolsonaro is president of the oligarchs, but the only way to to have that kind of society is a repressive one. So he's actually attacking democracy as president. And this, I think, shows that a much better way for our societies is social inclusion. It is to say we can't tolerate these high inequalities. That's the route to social peace. You know, for me, philosophically, I'm a follower of Aristotle, Aristotelian politics. And Aristotle said that the only way to have a stable society was to have a large middle class. And I think that this is the right philosophy. He said that 2,300 years ago, but I think we should take it to heart today that we need to rebuild the middle class as the key to a stable society.
Now, there is one quite interesting question about in a global recession, the ODA will lose in financing development. So, and there is a huge financial gap in financing the SDGs. So the question is, how realistic are our hopes pinned on private wealth, social impact investment?
I have no confidence that private capital can solve the problems of social inclusion. I'm sure that something can be useful, but basically, in my experience, public finance is the solution for social inclusion more than private capital. Of course, to some extent, private capital can make a difference if it's truly social impact investing that says, I don't need the rate of return, I want the social impact, then I applaud that. But the scale of that is not adequate, and the systematic nature is not sufficient, because too much private capital is what it does. It's after private returns. So we need public financing. We need a new international financing arrangement. would like to see the IMF play more of the global central bank function than it does, meaning making credits available to countries on a more equitable and larger basis so that countries can cover their financing gap. And I support the IMF making a lot of emergency financing right now so that no country has to face the choice, do I pay for COVID control or not? Because every country should have the emergency financing automatically that it needs to contain this epidemic, for example. So this is part of what I mean by saying we're going to have to revisit the international financing system so that it is more equitable. Right now, the Fed can print dollars. It gives the US a huge advantage. I don't know how long it can last because it depends on trust in the dollar, but it's not fair that Americans get the benefits of all of this money creation, but not the rest of the world. And so we need something that is more adequate in terms of the international monetary system.
Absolutely. I have two points, if you allow me, another two sort of. The first one is about the role of universities. What is the role of the universities could play in supporting sustainable development, equitable development, and the SDGs under the current circumstances of physical distance?
The universities are crucial because societies need to think. As a society, we need to have a brain function that says, what is the evidence? What do we know? What is the expert advice? What is the systematic approach to issues? This is the specialty of universities. Universities go back 1,000 years. Think of Egypt. It's got the, I think, the oldest university in the world, or one of them, in Al-Azhar. This is a great tradition of universities. Government and universities should work together on problem solving, to sit down together and say, how can we address systematically COVID-19? How can we address systematically inequality? How can we address systematically renewable energy? This should be a core function of universities, government, business, and civil society, all the major stakeholder partners in society. Brains, thinking. I was reflecting that in the United States, we're not thinking at all right now as a society. We have plenty of smart people. You can see the president doesn't think, he just tweets and acts. He doesn't, have deliberation. But it's worse than that. Congress doesn't think in the United States. We don't have hearings, systematic reviews, systematic studies. So this is why we're lurching from crisis to crisis, because there's no thinking going on. It would be like a body without a brain, or without the prefrontal cortex, that does the sophisticated thinking. We have emotional thinking, but we don't have cognitive thinking at the social level. So this, I think, is the university role. And I would hope that in Egypt, the universities could get together as partners with government to deliberate on some of these very, very tricky issues. This is why I helped to create the Sustainable Development Solutions Network with the Secretary General Ban Ki-moon and now Secretary General Antonio Guterres. The idea is to have universities take responsibility for thinking and have government call on universities as partners for brainstorming, because things are complicated right now. They're not simple. They really need reasoning, and they need systematic approaches, and universities are an excellent place for that.
Now, the last point is about developed versus developing countries, and the point actually was about how is COVID-19 likely to affect Africa's response? How can Africa recover to accelerate progress toward achieving the SDGs?
Well, thank you. First, I think the term developing and developed has to be changed. The developed countries, first of all, have done terribly in this crisis so far. So it's not as if the developed countries are showing the developing countries what to do. Maybe the most successful country in containing this epidemic is Vietnam, a low-income country that has had no deaths from this epidemic. It stopped the transmission right away. So developed and developing is rich and poor. That's a real thing. There are rich countries, there are poor countries, but developed and developing is a kind of moral judgment that or a direction that I don't think is an accurate reflection. The question is, how can any region right now that has that is fighting the epidemic, including Africa, succeed? And I've mentioned the importance of a public health system, a surveillance system, a quarantine system, a testing system, and a promotion of public hygiene. These are not so expensive. This is not as expensive as a lockdown of the economy, for example. It's important that governments say, yes, we will finance the basic public health system. In Africa, you know, the situation is also very dangerous, obviously, but there's some good experience because as a result of AIDS, TB, malaria, and Ebola, African communities and societies have experience with epidemic diseases. They've seen them before. Therefore, they have community health workers. They have surveillance workers. They know about monitoring and surveillance more than the United States does. So I say to the African leaders all the time, scale up your community health task forces, scale up your epidemic surveillance systems urgently, get the financing you need for testing and quarantine and public health from emergency IMF grants right now, and scale up, scale up, scale up.
Okay. Professor Sachs, I really thank you for your contribution. I know we were planning for half an hour and extra 15 minutes of your time, and I thank you for that.
Well, it's great to be with you, and thank you for what you're doing. And I hope we can continue to work together to help solve these problems together. We're going to be in this crisis for quite a while, but with good partnership and great universities, I think this can be done. And AUC is a great university, and I'm very proud to be part of the seminar series.
Thank you, sir. Thank you, sir.
Thank you.
Now, folks, next week we're going to have two interesting speakers. We're going to have Colin Mayer. He's a professor at Oxford University, and he's going to talk about on the business. On Wednesday, we're going to have Jeffrey Mazzolo. He's a principal at Emerging Markets,